Hi everyone, welcome back to my YouTube channel. Today we are going to talk about palatine bone. So let's start topic with introduction. Palatine bone is small, paired, irregularly shaped facial bone that is located at the back of nasal cavity. Despite its small size, it plays an important role in forming the hard palate, nasal cavity, and orbit. Each palatine bone consists of two main plates and several processes, making it a structurally complex bone of facial skeleton. Location and structure of palatine bone. It is found posterior to the maxilla. It contributes to the posterior part of hard palate, the floor and lateral wall of nasal cavity, and also the small part of orbital floor. Each palatine bone has two main plates, horizontal plate and perpendicular plate, and has four processes like pyramidal process, orbital process, sphenoid process, and nasal crest. Parts of palatine bone. We will talk about its plates first. So it has horizontal plate that forms the posterior portion of hard palate and it joins with the posterior palatine bone at the interpalatine suture. Its superior surface contributes to the floor of nasal cavity and inferior surface forms the roof of the mouth. Then second part of palatine bone is its perpendicular plate that extends vertically upward from the horizontal plate. It forms part of lateral wall of nasal cavity and contributes to pterygopalatine fossa and infratemporal fossa. Processes of palatine bone include pyramidal process, orbital process, sphenoidal process, and nasal crest. Pyramidal process project backward between the pterygoid plates of sphenoid bone. Orbital process are small processes that help form the floor of the orbit, while sphenoid process connects with the sphenoid bone and nasal crest formed by the union of both palatine bone, thus contributing to nasal septum that articulates with the vomer. Important foramina. It has greater palatine foramina and lesser palatine foramina. Greater palatine foramina is located near the posterior edge of horizontal plate and it transmits the greater palatine nerve and vessels. Lesser palatine foramina is located just behind the greater palatine foramina and little laterally. It transmits lesser palatine nerve and vessel. Articulations of palatine bone. Each palatine bone articulates with six bones. It articulates posteriorly with sphenoid bone. It articulates superiorly with ethmoid bone. It articulates anteriorly with the maxilla. It articulates medially with the vomer, and it also articulates with opposite palatine bone and medially at interpalatine suture. And it also articulates in inferior nasal concha laterally. Functions of palatine bone. First function is hard palate formation as this bone contributes to posterior portion of hard palate, thus separating oral and nasal cavity. Second function is nasal cavity formation as this bone helps form part of the lateral wall and floor of nasal cavity. Third function is orbit contribution as this bone has orbital process that forms part of floor of the orbit. Fourth function is pathway for nerves and vessel as this bone has foramina that allow passage of palatine nerves and vessel, thus supplying the palate. Fifth function is support as this bone provides structural stability by connecting maxilla, sphenoid and other bones. Conclusion of this lecture video. Palatine bone is small but complex bone that plays an essential role in formation of hard palate, nasal cavity and orbit. Its plates and processes not only provide structural support but also serve as an important passageway for nerves and vessels. Despite being less prominent compared to other facial bones, palatine bone is crucial for functions such as speech, swallowing, and breathing. And this was all about palatine bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.